Welcome to the presentation on lymphedema therapy in skilled nursing and long-term care. This presentation will discuss the following: a brief description of the lymphatic system, what lymphedema is, and the components of lymphedema therapy. We'll also introduce you to the types of lymphedema maintenance garments that you may see on your residents and discuss what to do for ongoing care. About 3 liters of fluid from blood vessels seep through the capillaries and into the body's tissues each day. This fluid picks up proteins, minerals, fats, damaged cells, cancer cells, bacteria, and viruses from the interstitial tissues. The lymphatic system is a network of tissues, vessels, and organs that work together to collect this excess fluid and debris called lymph. The system filters the fluid, produces and adds lymphocytes, disease-fighting cells, and returns the fluid back into your bloodstream. How does the lymphatic system get interstitial fluids back into the bloodstream? Lymphatic vessels run throughout the body just below the surface of the skin. They transport lymph away from tissues and bring it to the lymph nodes, which cleanse the lymph, and toward larger vessels called collecting ducts, eventually leading back to the heart. Lymphatic vessels work under very low pressure and have a series of valves in them to keep the fluid moving in one direction. Remember how we said lymph fluid picks up damaged cells and other invasive cells? The lymphatic system doesn't just circulate the fluid, it also cleanses it and adds disease-fighting cells. Along the pathway back to the heart, lymph passes through lymph nodes, which are glands that cleanse the proteins, damaged cells, and other invasive cells from the lymph, like a filter. Lymph nodes don't just filter, though. They produce and store lymphocytes, a type of white blood cell, that attack and destroy bacteria and other harmful substances. As the filtered lymph leaves the lymph nodes, it takes lymphocytes along with it back into the bloodstream so that the lymphocytes can travel to anywhere in the body that they're needed. When a blockage or failure occurs in the lymphatic system, excess lymph collects in the tissues, invasive cells are not filtered out adequately, and lymphocytes have difficulty getting to infected tissues. This condition is called lymphatic obstruction or lymphedema. Let's talk about how lymphedema happens, what it looks like, and how it affects our residents. The most visible sign of lymphedema is swelling or edema distal to where the blockage in the system is. We'll be giving examples mainly of lymphedema of the legs because that's what we see most commonly in skilled nursing and long-term facilities. However, lymphedema can occur in the arms, face, genitals, or other areas of the body. How does the lymphatic system get compromised in the first place? Sometimes the damage is in the lymph nodes and sometimes in the lymphatic vessels. Lymph nodes can be damaged from infection, surgery, radiation, or trauma. Vessels can be damaged when the system is overwhelmed, as in the case of chronic venous insufficiency. Sometimes people are born with a damaged lymphatic system or have a genetic mutation that leads to lymphatic system damage over time. Here's what lymphedema can look like. Pitting is when the skin shows a temporary dimple or pit after being pressed. Thickening of skin or fibrosis occurs when connective tissue fibers start to develop in the skin and underneath it. Hyperpigmentation or hemosiderin staining is when skin becomes darker and patchy. It occurs due to excess protein in the tissues, which stains the skin. With excessive edema, you'll also see increased skin folds develop. A resident with lymphedema develops various functional impairments. The edema causes restrictions in range of motion and adds heaviness to the limbs, which can create difficulty with ambulation, transfers, ADLs, and general activities. The patient may have aching or discomfort caused by increased pressure on the nerves or abnormal stretching of the tissues. They're at higher risk for recurring infections, especially cellulitis, due to the excess protein in the tissues, which feed bacteria, and the difficulty for the lymphocytes to get to the tissues. Wound healing is also compromised due to those factors. With these impairments, the resident may feel embarrassment or anger, leading to depression or other psychological distress. Lymphedema is not curable, but it is treatable through lymphedema therapy. Now we'll talk about the process of lymphedema therapy in a skilled nursing and long-term care setting. If you notice a resident has signs of lymphedema, request a doctor's order for lymphedema therapy for the affected areas. A certified lymphedema therapist, or CLT, will complete a medical history review and evaluation of the patient. The CLT may recommend compression garments alone, or they may start seeing the patient for more extensive lymphedema therapy, which includes manually moving the lymph through the body, compression, exercise, skin care, and patient and/or caregiver education and support. There are two phases to CDT. The decongestive phase, which generally means reducing the edema and rerouting the flow of lymph to the lymphatic system, and the maintenance phase, where measures are taken to keep the lymph circulating and prevent fluid from settling in the interstitial tissues again. The decongestive phase is guided and implemented by the CLT. One component is manual lymphatic drainage, which is a skin stretching technique that stimulates the lymphatic system and helps protein reabsorption. The CLT will clean and hydrate the skin with low alcohol content lotion. Depending upon the facility protocols, the therapist may assist with wound dressing under the direction of the nursing department. Compression bandaging, applied in a specific manner for lymphedema, will be completed by the therapist. During a lymphedema therapy session, the patient will also participate with exercises designed to increase lymph flow, receive education regarding lymphedema, and may also receive general psychological and emotional support. The compression bandaging technique used by the lymphedema therapist is designed specifically for edema control. It's a multi-layered technique using stockinette, foam, and bandages with a specific amount of bandage overlap as well as bandage direction. They're applied in a manner which stimulates lymph flow and assists the muscle pump action to increase lymph flow. Wraps should remain on between therapy sessions except for bathing and wound care, which should be coordinated with therapy sessions. The wraps should be removed if the patient reports that they are painful. If they are removed or if they fall off, save all the pieces in a bag and leave them in the patient's room for the therapist to find easily. It's important to note the type of bandages used for lymphedema therapy. These are short stretch bandages as opposed to ACE bandages, which are long stretch bandages. Long stretch bandages provide the opposite effect of what we're striving for, and they may actually exacerbate lymphedema. The following video will help explain this concept.
When utilizing compression, it is very important to understand the different types of compression that are available, both long stretch and short stretch, because both of these types of compression directly impact how the compression works and the impact they will have on the venous, the lymphatic, and the arterial systems. What we are striving for is a high working pressure and a low resting pressure. What that means is when the bandages are in place providing compression is that they provide a resistance for the muscles to work against to facilitate that calf muscle pump and redirect that lymph flow and that venous flow back up towards the heart. What happens with resting pressure is that when the muscles are at rest or when the patient is relaxing, the compression should not be so tight as to be causing a tourniquet effect. The way we can achieve this is with using short stretch compression. And if you look at short stretch compression and the way that it's manufactured, it will only stretch 20 to 40% of its original length. And this is what is important to remember when utilizing these types of compression bandages to support venous insufficiency or lymphatic compromise. The difference between short stretch and traditional long stretch bandages is that long stretch will actually stretch or extend almost up to 140% its original length. This directly impacts working pressure and resting pressure. So using long stretch actually does the reverse, where you have a high resting pressure and a low working pressure. This is not what we want when we're addressing lymphatic compromise or venous insufficiency. We want a system such as short stretch that will provide that high working pressure and that low resting pressure to achieve adequate venous and lymphatic return.
The decompression phase ranges from 2 to 8 weeks typically and ends when the CLT determines the maximum edema reduction has been achieved. At that point, the maintenance phase of lymphedema therapy begins, which is guided and implemented by the nursing department. This phase involves elevation of the affected limbs as much as possible, ensuring walking or exercise programs are followed, close attention to skin care, and proper hydration and diet. The lymphedema therapist will recommend compression garments for the resident to wear daily. It's vital that the nursing department apply these compression garments daily and remove them at night. Next, we'll introduce you to some of the maintenance compression garments that may be recommended for the resident to wear. At the end of the decongestive phase of lymphedema therapy, the lymphedema therapist will recommend and help acquire the appropriate maintenance compression garment for the patient. The garment should be worn every day and be removed at night. The types of maintenance garments include graduated compression tubing, graduated compression stockings, and Velcro type compression wraps. Let's start with graduated compression tubing. Examples are TG shape and Tenso shape, which offer a light compression value. Because they provide more pressure at the ankle and gradually decrease the pressure towards the knee, it's important to put these garments on correctly, not upside down. Note that these come in individual packages and are not the same as uniform compression tubing, which comes off a roll like Tubigrip. Tubigrip and other uniform compression tubing does not vary the pressure value up the length of the leg, which is what a lymphedema patient needs. To care for graduated compression tubing, wash by hand when removed at night, roll up in a towel to remove excess moisture, and hang to dry. Similar to graduated compression tubing are graduated compression stockings, such as Jobst stockings. These are more durable than compression tubing, last longer, and come in a variety of compression value ranges. They should not be confused with TED stockings. They're made differently and have a higher compression value than TEDs, which are made for the prevention of blood clots for people who are immobile. Keep in mind the phrase TEDs for beds to remind you that TEDs are for bedridden persons for anti-embolism protection. Like compression tubing, wash graduated compression stockings by hand when removed at night, roll up in a towel to remove excess moisture, and hang to dry. Another type of maintenance garment that you might see are Velcro compression wraps, such as Ready Wraps or Ferro Wraps. They're made with short stretch materials and allow variable compression values. They can be easier to put on than stockings, especially with wound involvement, because application involves less shearing. They should not be applied directly to the skin, however. A liner must be worn between the skin and the wrap. The liners should be washed at night like stockings, but the wraps should be hand washed only when soiled. Remember that lymphedema is not curable. Once the damage is done to the lymphatic system, it doesn't go away, and it requires ongoing care. To provide the best ongoing care for our residents, ensure the recommended maintenance garments are worn properly and daily. Encourage the patient to elevate the affected limbs as often as possible. Ensure the resident participates with their walking program or exercise program if they've been given one. Promote drinking lots of water unless other medical conditions contradict this. Finally, if you see a return or worsening of the signs of lymphedema, contact the therapy department for a screening or reevaluation.